that most of you would have attended the training by Dr. Jyoti Sood about a week ago around what the program entails, what the combined health check should look like, who the cohorts or the patients it's aimed at. So what I'm just going to quickly touch upon is, reminding you of those very briefly. So it's a combined health check program. The idea is to have one health check for your patients with severe mental illness, learning disability, and autism. As you know, it's not applicable to all the practices at the moment, just selected ones yourselves. It's a pilot project. And in terms of the resources, we've worked alongside the project management team to work on the template, the searches, and the health action document, or the health action plan documents. There are two of them, the generic and the easy read documents. And during the training, we will be going through those and looking at how you would be using these resources. In terms of the patient groups, so you would have the searches that you'd be using. For the severe mental illness patients, we've used the QOF register. For the learning disability, we've used the QOF register again. For autism diagnosis codes, we've used the primary care domain RefCert in agreement with NHS England. So if your patients are have an autism code that does belong to the primary care domain RefCert, then of course they would be picked up. From what I recall, there are about 43 codes in the primary care domain RefCert for autism. In the template, which Tracey will go on in more detail, we will have the different pages. There will be a page to begin with around reasonable adjustments that, as you know, according to NHS England, is now a requirement for practices to record any reasonable adjustments that a patient may require. The reasonable adjustment page is on all the current CEG, all the relevant current CEG templates. I understand that from your previous training with Dr. Sood, there were some questions around what that exactly entails. I'm going to just show you a couple of screenshots of what the page looks like, and Tracey will go in more detail around it. So at so the plan for NHS England is to automatically flag patients with reasonable adjustments within EMS by the end of the year, I believe, or at some point. So what we've created at CG is a bit of an interim solution to allow you to assess, identify patients who would need reasonable adjustment, flag, record that, and also record the different kind of adjustments they might need. You will need to make sure that you are recording the reasonable adjustment and entering the code on the page so that your patient is flagged on the NHS digital reasonable adjustment flag sort of a register. This is it's just one page, but it's continuum. This one allows you to identify and record. This one allows you to, the second section on the page allows you to record in more detail what sort of reasonable adjustment or what sort of adjustment your patient would need. So for example, if they need a certain type of communication support, do they prefer auditory communication methods? Do they prefer written communication methods? Do they need interpreters? Do they need to have sign language interpreters booked in, etc.? All these have got drop-down lists that, again, we will show you later on in the training, but this is what the reasonable adjustment page looks like, and those are the two sections that you will have. So with the combined health check, it's fairly straightforward. I will do a live demo, but before we go on to that, I want to first show you that we've got the recall searches. As you know, like I said earlier, it's for patients with autism, patients on your QOF learning disability register and mental health register. There are 8 searches to allow you to have the flexibility to choose which ones you want to get your patients from. So you've got your patients with just autism diagnosis. Then you've got number 2, patients with your learning disability on your learning disability register. Then patients on your QOF register. Then you've got patients with both LD and autism, or SMI and autism, or SMI and LD. Patients with triple diagnoses, and patients with at least 2 of the diagnoses. So they would be either in section in search number 4, number 5, or number 6. These searches would be the ones that you would use to recall your patients. Then you've got the payment search, which you would use to, again, track how much of the work you've completed. As per the service specification, ideally we want a good spread. So the requirement is for at least 25 patients to be checked in each of the cohort. So that's from cohort 1 to 4. So 25 patients with autism at least, 25 patients with LD, 25 patients with mental health, and at least 25 patients with a combination diagnosis. We have identified a code. Again, you would be able to see that during the template demonstration. The code is review of systems, and that code you would need to enter for you to distinguish between your patients that you've carried out your routine LD or SMI health review from those that you've reviewed under the combined health check program. And the last search will allow you to have an idea of how many reviews you've carried out so far in total. So the total count of review of systems for that you've entered within your practice. Currently, the reporting period is set to be for the 1st of July until the end of this financial year, which is the 31st of March 2026. As I mentioned earlier, it's an iterative process. Should circumstances change and the project is prolonged, we will adjust the search time frame accordingly. But for now, they have been set for the 1st of July all the way to the 31st of March 2026. I'll quickly just show you. So, bear with me a second, as you know. So at the moment, the searches will sit in your likely in your PCN support folder. At the moment, they are in our development folder, and they will be published in your PCN support folders in your locality respectively. So as you can see, you've got your recall searches. You can use to identify you can run them and see how many patients are on your practice, and then you can look at the payment searches. I would advise for currently, as you can see, this one is for Tower Hamlets. We don't have any count for those review of systems code. If you do run your search in your practice and you do come up with a figure, please let me know so that I can check that, because what we don't want is for that code to have been used for a different reason, possibly internally in the practice. So if you do have existing numbers that's coming up under your payment search and you've not really started the work yet, please let us know. Any questions around the searches before I hand over to my colleague Tracey for the template demonstration? Have the searches been sent? No. So the searches will be published. They won't be sent to you, and the moment they've been published, I will let all of you know. Yeah. Right. Lovely. I'll hand over to you. back. Okay, thank you, Karishma. So I'm going to, I need emails. Go back to emails. So your new template, it's called the Combined Health Checks Pilot, now CEG version 1. Let me just get that down there. And you will be familiar with a couple of the pages. So with this, you've got your reasonable adjustments page, which you will see in the majority of our templates, especially if you are using the LTC template. This is a standalone page in there. You've got an examination and history page. You've got your learning disability page, which again, you'll be used to seeing in your LTC. It's just a slightly shorter version. And the same with the mental health page as well. It will be the same as what's in your LTC, just slightly shorter because some of the information has been moved out onto the examination and history page. You've got a women's and men's health page, your lifestyle intervention page, again, which you have on all of your templates, and the same with your wider determinants and your ethnicity. We have got a resources page there as well, which I'll go in a bit more detail as we go along. So as Karishma explained earlier, here is your reasonable adjustments page. And you have to record all the information that's got the stars on. So you have to make sure this section is completed here, the top section. Can you see my, yeah, we see the mouse. So the top section here, that these are completed, because some patients may not agree. They may decline the reasonable adjustments flag. So make sure that you are recording that. Then if the patient, say for instance, you've recorded this at the beginning of the year, and then you are going to review their reasonable adjustments in the middle of the year, so say around about December time, make sure you tick this box. Whenever you are doing a review of the adjustments, make sure you tick this box so that it's recorded that you have actually reviewed them. And then here is your impairments section. So here is where you would pick the general idea of what it was. So whether it's vision, hearing, memory, etc., you pick from here to categorize it. And then to be more specific is when you go into the adjustment required. So I'll just show you a few. So on here, you can see needs British Sign Language, Makaton, needs an advocate. You have all of the different requirements that would be needed for this section. You've also got for someone that requires communication needs. Again, so do they have difficulty processing information? Have they expressed pain? Atypically, requires an appointment reminder. Everything you need can be found in any of these different drop downs here. And then what happens is, once, unfortunately, I can't demonstrate this because we are in our EMIS and not in a practice. Once you've recorded this information for the patient, it will come up here. I'm just going to close this down. On your alerts, it will say digital flag adjustment. So if you have that in here, you will know that that patient does have some kind of adjustment recorded for them. And like I said, is if you are going to review it, just make sure that you tick the correct boxes to make sure that you've done a review on the patient. Okay, so that's your reasonable adjustments page. And then, so moving on to the examination and history. So as I mentioned before, some of the information has been taken off of your mental health and your learning disability pages and put on here. So we've tried to make this flow in a way that works where you would see someone in a consultation. Obviously, we have had clinical input from Jyoti and Judith on this. So you'll see here, we have also left your QOF information on here because some of the general examination is what is required for your SMI patients. You have your general examination, so your usual, your height, your weight, your BMI, your pulse. We have actually put in there if they've declined to have their height, weight, and even their blood pressure recorded.
and you've got your smoking status in there and your alcohol consumption. So hopefully everybody that's on this call is used to using our templates, so you know that they tend to flow within the way that you're seeing the patient and the way that when you're having the consultation, it flows naturally for you. And then, as Karishma stated before, here is where we start. So here is your systems check. And this is the code that you need to record when you are seeing any of these patients. And the reason we put it down here and not at the top is so that you can do the general examination first and then move on to say, okay, right, we're doing the health check, and then you can move on and do the rest of the information. You will note that there is not a page for autism, and that's because the information from systems check downwards is catered for the autistic patients as well as your learning disabilities and your mental health. So if you do note that, it's fine. All the information that we have on here will cover those sections. So you've got a general health section, you've got, oops, sorry, that jumped, respiratory. Again, so it's just going through, so doing individual general examination, and you've got the areas where you can free text. So any information that you wish to put in there, you can text. Same with your respiratory. You've got your gastro part as well. Your central nervous system, again, that's your free text box. So once you're doing the assessment, you can type in the information here as to what you want to put in there. Any relation to epilepsy. Sorry, I meant to say this at the beginning, just to point out that this template has no visibility rules on it at the request of the clinicians. Whereas ordinarily, if you was using your LTC template, you would find that if you're seeing a learning disability patient, only the learning disability page would come up, but this has no visibility rules on it so that it is accessible to any 3 of those cohorts of patients. So you will need to go through the whole template to do all of the patients for the 3 cohorts. So you've got your epilepsy part, cardiovascular in there, so the Q risk in there, diabetes, because a lot of the ailments relate, you know, if someone has learning disabilities, they may also have diabetes as well. So this is just the gateway. It will tell you if they are on the diabetes register, and then if you need to do your diabetic assessment, but not saying you need to do that at this point, but it may come later on in the year that you do know that you might need to do a diabetic review on them as well. Foot care, autoimmune system. So you have a lot of different areas that this covers that you can just add information in for the patient. Your dental, because that would apply to your learning disability and your autism patients, whether their skin or their scalp, if they have any issues around those. And then any additional symptoms, so something that is not listed on here, you can also put in there. So if the patient has a concern about something, like, as I said, that's not in here, then this is where you record that. So they had back pain, for instance, you could put the information in here. If they are requiring specific tests, whether it be blood tests or any other tests, we've got that in here for you, because there could be a blood test that's not on your normal blood test form. So you can just use this section for doing your test requesting. Any issues around sleep, so that's got your sleep patterns as well, whether they're good or bad. Any continence issues, any other pain in any other areas, any falls, if any of the patients require that. Your vision and hearing. As you'll be aware, you are used to this being on one of the individual pages, but like I said, this has been moved because it can be applicable to all 3 of the cohorts. So vision, hearing, and mobility. You've got your daily living skills. So does any of the patients need any assistance with any eating, dressing, bathing, etc.? You can record that in here. And if they need need to be seen by the occupational therapist, sorry, not the referral, you can do that from here. We have put the medication review on this section, but you do also, which I'll show you, still have the medication review on the mental health page as well, because that's more of a structured medication. And you can see down here the different medication reviews if you do need to do a specific one rather than just your general medication review. Any allergies is on there. Any additionals if somebody is misusing drugs or they need to be referred and need to have a intervention, you can do that there. Has the patient got a carer who provides the care, carer details, etc. is all on here as well. You may be used to that being on a separate page on other templates, but that's been put on here for you. And does the patient have a support system? So do they have any help, whether it be from a family member or outside help? Do they have a social worker or educational worker? All of that information can be recorded here as well. And then if there's any safeguarding concerns as well, you can record that there. So that's your generic examination and history page that you will fill in for all 3 cohorts. And as I said, moving on, your learning disability page is not as long as what you're used to because the other parts is on the examination page. So you can see you've got your learning disability review there. So again, you've still got your stars in there, making sure that the information is ticked. So it covers your QOF as well as any of the incentive schemes that you are doing as well. You've got structured medication review here as well. Any mental health care arrangements? Do they have key workers, etc.? And if they need any referrals, you will find all of the different area referrals here if you need to send them to the learning disability team. Any other? So if you believe they might need a psychiatric referral, you can do that there. And if they have any behavioural problems. And then if they've had any previous immunisations, they will come in this section. If not, you could go in and then use the adult immunisation template, which is separate if they do need to have any of their immunisations done. Your mental health page, again, because you do have QOF indicators for this as well, we've left this on here as well as it being on that main examination page for you. Sure that you tick all your boxes for your QOF. Any additional, again, so it does have the drug misuse, any diet advice, exercise advice. Your care plan section, so making sure that you are doing your care plans for them on a yearly basis. The depot monitoring section, any histories of, any risk of self-harm is also in there. Any referrals that you may need to do as well. And then just your general information on your medication, as well as any side effects as well. Then you have your separate men's and women's health section. So you've got your areas that apply to your women, around periods, any screening, any breast screening that needs to be done, or if it has been done, you can enter the results as well from here. And then any men as well, making sure if they need to have their testicular exam done, you can record all of that from in here as well. And then you've got your lifestyle intervention. Again, this does vary in different areas. So you may find if you are from one area, it might look different to what you're used to, but it all has the right information in here. It's got your smoking section. It's got your diet and your exercise. It's got your obesity section. It's got your alcohol screening. Questionnaires. Any further interventions that may need to take place. Your mic out options as well, which is a lot. You can pre-text your answers in there. And any social prescribing. So if you're doing any referrals or if the patient has declined to go to the social prescriber, you can also record that from here as well. And then it refers for further assessment. And then there's just a few resources for the clinicians as well. Hopefully you're all familiar with the wider determinants as well, because you have been doing that for the last couple of years. And again, this is really important to have this information recorded because it does lead into the other pages that you have previously done on this template. around communication. Again, does the patient need extra help when it comes to communication? Do they have a health literacy? Do they have housing problems as well? Employment and income, again, you can record all of this information through here. They may need additional help when it comes to any of these sections. Again, so what you would do is with these, if they do require additional help, you would refer them to the social prescriber. So again, the social prescribing section is here as well. And then ethnicity, if you're at a stage and a patient has missed and doesn't have their ethnicity, you can record it in here, but hopefully the majority of practices do either have 99% or 100% of their ethnicity recorded. But if you do come across someone, you can record it here. And then you've got your resources page. At the moment, this is very small, but we do plan on building on this. As Karishma said, there may be some changes throughout the coming months. So it will just mean that we will make your guidance and resource section just slightly bigger for you on there. Does anyone have any questions around the template before I just briefly show you the 2 documents that we have for you? No? Okie dokie. Second. Okay, so you have 2 action plans available to you. You will see one of them is for your learning disability and autism patients only, and the other one is a generic which you can use on the other patients. Oh, yes, okay. We have, it will bring in as much, we've tried to make it bring in as much information as possible. So hopefully you don't have to enter too much information. Bear with me a second, it doesn't seem to be. There we go. So it will bring in your patient's name and NHS number. And then you just have to go through and ask the question. So are you going to be requiring them to have a blood test? Are they going to need a urine test? Are you making another appointment for them? Or do they need to go see the dentist, the opticians, the podiatrist? So today we have noted you need to have the following. So they may need to have some additional screenings or some of the vaccinations that they may not have had done. There is also a section here for you to free text about their mental health. So having a conversation with them, seeing how they're feeling mentally, and you would record it here. And then they would need to set 3 goals for themselves to achieve within the 6 months. So you just need to record it here. And then who will help them achieve their goals. Again, so it's just making sure all of the sections that you're recording, all of them, and how do I achieve my goals? And then you've got additional actions. So there may be something you're requiring of the patient, which you would put in there. And then if there's also something that you as a clinician need to follow up on, then you would put that in here as well. And then signed by whichever clinician's being seen, by the doctor or for the nurse. So that's that one. They're both very similar. And then your generic form. Again, so it brings in the name and the NHS number. You've got your tick boxes here. So you can tick exactly what you've discussed. It'll also bring in their height, weight, BMI, and blood pressure. You need to record what this means to the patient, and then also any actions that you've agreed between you, you'll need to put them here, whether they need to have, like I said, a blood test, or you're going to send them for additional treatment, make sure that that's put here. And then also a follow-up appointment, make sure that you're putting that in there for them. It will auto-populate if they've what immunizations they have, so you can see if they are missing certain immunizations, as I said previously, that they need to have. And then you've got your plan section. So you can put your plan care plan review in here, exactly on what you're deciding. And then the goals that they decide. So again, there's 3 goals in this one. What are my first steps to achieving my goal? How will I be supported to achieve my goals? Is anybody going to help them? And then any additional information on there. And also to put when will this be reviewed. So when you're going to do a follow-up review, if needed, make sure that you put the date in there for them. And then again, just signed by whoever they're seeing, the nurse or the GP. Does anyone have any questions around the document?